Hello and welcome to another edition of For the Record. I'm Sean Murphy. My guest today is Pat Wilds. He's an AmeriCorps member, and we're here to talk about Community Health Corps today. It's his first time on the show, so welcome to the show.
Sean, thanks for having me. It's really a pleasure to be here.
Pleasure having you here. So let's start out with a basic definition of what Community Health Corps is.
Sure. Well, I think a lot of people have heard of AmeriCorps. That's kind of the umbrella organization that we work within. Community Health Corps is a sub-program. So everyone that's in it has a four-year college degree, and we work in community health settings. Whether it's in a community health center, an organization, an agency in the local community, we're focused on local health issues, and that's what we do for anywhere from 10 to 12 months.
And you specifically as an AmeriCorps member, what do you do?
I'm in our public relations marketing department, so I do a variety of things. I kind of jump all over the place. I look into even some of like the legal things that we like to look into as an organization, health law, health policy, anywhere from that to, like I said, public relations stuff. So
Which means you're coming on TV shows like this.
Yeah, been on a show recently, and just trying to spread the word about what the health center does, and having fresh young faces. I think we have quite a great impact doing that.
Well, let's talk about that. What does the center do? What's it all about?
So the Community Health Center Incorporated is headquartered in Middletown. We actually have a site right on the other side of the plaza here.
Yeah, where we shoot. There's literally, and those fine folks have been on the
Right.
show before too.
Right.
And it's a great organization.
Right. So New London's one of our sites. Big sites in Meriden, New Britain, and a bunch of more satellite sites. So we're down in Stamford and Norwalk and over in Danbury, Bristol, Enfield, Waterbury. We're really through and through pretty well across the state. So we're really happy about the impact that we do have.
And it's kind of, for people need to understand that it's like an alternative to just walking into a doctor's office or
Right.
even walking into like a typical clinic per se.
Right.
You
The Community Health Center does not turn patients away. Our motto is healthcare is a right, not a privilege, and we really do stick to that. If you're uninsured, if you're underinsured, if you're underserved in any way, we find a way to get you care, and we're really, really proud of that. We provide medical, dental, and behavioral health care all under one roof, which is really innovative, and hopefully it sparks like a really great movement in doing that. But the way it works is if you come in for a medical appointment for the first time, we see you within 2 weeks of that actual first encounter. So if you come in and say, I want an appointment with any of your providers, we can set that up very quickly. During that first encounter with your provider, we actually administer a few behavioral health questions that you might not even notice. So we're kind of doing a small behavioral health evaluation in your initial visit, and if your physician thinks that maybe there's some red flags from those questions, then we can bring you in with a behavioral health clinician within the week as well.
I want to back up to the, just the simple, or what you would think would be the simple task of making an appointment with a typical doctor's office. There may not be an appointment available, but you are guaranteeing that within a couple of weeks, you will, no matter what your issue is, you're getting in and you're going to be seen by somebody.
Right, and that's something, like I said, we're really, really proud of that. And each day, we're working on improving the quality of care that we provide, because the last thing we want is just to say, oh, well, if you have nowhere else to go, then you have to come here. We want you to come here. We want you to get a high quality of care, not just any old doctor's appointment.
Was that part of the reason why, it was decided that something like this was necessary? Just like the traditional or the standard ways, just people were just not happy with it?
Yeah, I mean, I think it was that, and I think it's just, it's a growing need in the U.S. for people to be able to not have to go to the ER to see a doctor, not have to go to a walk-in clinic to see a doctor. Because what we can guarantee is if you come in and you like your physician, or if you don't like your physician, you can switch to another one. But our goal is to get you into a continuous relationship with a medical provider, or with a dental or a behavioral health provider, so that you can feel comfortable coming in and getting care, not just feeling like I go once to a walk-in clinic, they tell me what's wrong with me, and then I have more long-term problems that aren't even addressed.
And I'm sure that we've all been in an ER. ERs are littered with patients that don't necessarily belong in the ER, but they either had no other option, or that was their own. They just didn't know where else to go.
Right, and another thing that we can boast is that there's not going to be that 4 or 5 hour wait that you sometimes see at an ER. We're not prioritizing you in terms of your actual condition. That's why you come in. We set up an appointment for you to come back. So when you come back, we give you our undivided attention.
Another thing that I really like about community healthcare, and others that have been on the show talking about it, is just the amazing way that they're networked no matter where you go. And you talked about the facilities all over the place, but all your information, they're using the latest technology, your records, it's an iPad click away for some, in certain instances of all your stuff. So no matter where you go, you're good to go, basically.
Right. Yeah, and in the department that I work in, social media is a big part of what we do as well, and that's kind of something that we've really been focusing on, and at least in my time here, but I'm sure well before I got here. Having a Facebook account, having a Twitter account, we're actually working on getting I think maybe even Instagram account going.
Wow,
Anything
you're
that we,
really in social media.
yeah, on Pinterest, anything that we can do to accommodate our community. And a lot of times people are more likely to go on and check Facebook than actually go on our actual website.
Absolutely,
And if that's possible. Yeah,
I would argue that the social media, a Facebook page is more because it's more it's a network. It's more a website is static for the most part,
Right.
but people are on Facebook together at the same time. It's as equally important, if not more important, than a company or an organization's website. I
right.
think.
Yeah, absolutely. I agree. Yeah.
So we move along, and I just want you to touch for a moment, because we're going to get into stuff like the 5K. But I want to have you touch a little bit on the states of health in general in the country, and maybe like Obamacare coming up and people's thoughts on that. Any thoughts on that?
Yeah, I think that I think we're really, really, really glad that the Affordable Care Act is going to be coming into play in the next few months.
Does that help you? I mean, it helps your patients for sure.
Yeah, I would agree. I think that it's going to be an interesting time because people are going to have, like I said before, the community health center sometimes is the only option that people are going to have for seeing quality care. That might change now because people having insurance that didn't previously have it, or being on Medicaid that didn't previously have it. That's going to open up some doors for people, and how they go about looking through those doors and finding opportunities for healthcare is going to be really interesting. But I think that we're going to benefit from it, and we're really looking forward to its implementation.
Just by the fact that people will be able to utilize your services more.
Right, absolutely.
Not that you were ever, like you said at the opening of the show, not that you would ever, no one gets turned away.
No,
anyway.
not even close, no. We want everyone that comes in our doors to receive a high quality of care, and we're going to stick to that regardless of what the healthcare system looks like. So.
Is it a slow process of getting the word out as far as this, as opposed to the more traditional methods that people would go for care?
It really depends. We've been in Middletown for 40 years. Actually, our 41st anniversary as an organization is in the next day or two. So we're really, really proud
Happy
of that.
birthday.
Yeah, thank you. So I think in a place like Middletown, we have a pretty strong root, and everyone in the community kind of knows that we exist. It's tough when you open a new site, because if you go into any major urban area, which we've been trying to do, like I said, Meriden, New Britain are just a few of the places.
Is that key for you right now?
I think so, but we're up in places like Enfield, which maybe are a little bit off the beaten path. So we're really trying to, be in communities where we're needed most. We're not just going to open a center in a town that just, it looks nice. It looks like it would be a nice place to open a center. We're committed to going to communities that could really benefit from our services. So getting the word out once we're there, that comes a lot of it down to the AmeriCorps members that we have and our access to care people. So we go out, we'll go door to door, we'll do outreach, we'll be holding up signs, giving out flyers to just let people know, hey, take a step inside, take a look at what we have to offer, and we think you'll be impressed.
As far as your openness and availability to everybody, is there a situation ever where you have to sort of train people's opinion that you're not just designed necessarily, because you are in the large urban areas, you're not necessarily for like low income or a particular type of individual?
Right, well, I've actually spoken to a few people, and this was even during orientations. This was last August. I spoke to a few people who said, I go to the community health center or one of its satellite branches for my primary care visits, and it's not because I feel like that's the most affordable for me, but because I honestly think that's where the highest quality of care is. And that, to me, was really resounding and really powerful.
That's a big deal.
That's really great. Yeah.
When you choose to have, when you like the doctor so much, and it happens to be at this facility, that's a big deal. Because you might think that a typical clinic might, it might not. I don't want to use the term not the highest quality, because I don't think that's fair. But you know what I'm saying.
Yeah, I spoke to a patient the other day actually, and obviously I can't speak to who it actually was, but she was saying that she's so glad. And so happy with the relationship she has with her provider, that she feels so comfortable coming in now, and she can easily go to her group of friends and say, hey, I have a really great doctor here, and maybe you won't get along particularly well with him or her, but you'll find someone there that you'll really appreciate. And developing that relationship between patients and their providers, whether it be a nurse practitioner, a behavioral health clinician, a dentist, a dental hygienist, whoever it might be, that's really important to us.
How do you keep healthcare costs down? Is it possible?
I think it's tough because, like we said, the quality of care is so important, and not just the fact that we're providing it, but that it's good quality. So, I mean, the costs are gonna come with the advances in the industry, I think.
How about insurance? Why is that so expensive? Is it just a domino effect?
I think, I think that's what you're getting at, yeah.
But like we were talking about before, maybe access for more people will certainly be helpful to them.
Absolutely, yeah.
Let's talk about the Meriden 5K.
Sure.
What's it all about?
So the Community Health Center has been planning for a while to make a 5K and to enroll as many people in the community in doing so as possible. Unfortunately, the events in Sandy Hook and Newtown kind of provided a renewed impetus to that whole idea. We'd always kind of been struggling about, well, we want to hold a 5K, we want to hold a great community event, we want all the proceeds to go to a great cause. But what is that? And you hate to say that, tragedy is what brings that on, but we were so focused after that and saying, what can we do? And we felt like it might be a little too much to bring the event to Newtown itself, so we figured, why not do it in one of our cities where we're already established and where we can have an even greater impact.
Is Meriden designed, and because is that the centralized point as far as the community health facilities?
It's close. It's a few miles from Middletown. So like I said, our headquarters are in Middletown, but we have a very large site in Meriden. We also, Mayor Mike Rohde, the Meriden mayor, is actually an employee of the health center as well. He's our community relations director. So having him on board and having him be able to offer all his connections and all the people that he knows to our cause was really helpful as well.
Yeah, when you try to put on an event like this, I think
Right.
local
Right.
politicians certainly come in handy to try to get it off the ground even.
Right. Yeah.
Was this in the planning stage before Sandy Hook happened, or was it a result of that?
The 5K had been in the planning stages. There had been several attempts to plan one, but this was kind of the time when it really got off the ground. And part of that was talking to the mayor and saying, hey, we want to do this event. And he said, I've been affected the same way you guys have been. It's terrible, and I have the connections, and I can take care of all the logistical stuff. So having a police officer on site, having a public park reserved, having even anything down to like having toilets available, public toilets for an event like that, he can take care of that stuff for us. And if we're doing that on our own, that's kind of a nightmare. So.
Yeah, there are so many things that can fall through the cracks,
right?
Especially if you're doing it for the first time, or you figure. I've got enough staff, I don't need it. You can probably never have enough staff to make sure everything goes smoothly. But the tragedy that occurred, it probably, even though the event was planned ahead of time, is really kind of laser sharp focused and gave you resolve, right?
Right, and it's the mental health and behavioral health thing that for us is really really important. Since, as I said before, we do have behavioral health care at all of our centers. Having that for us means that not only is it something that we care about, but something that we know about. And that's really something that we can say, hey, we actually sent providers down to the Sandy Hook and Newtown and related areas after the events. So we have providers who've not only been in the trenches helping out, but who are interested in helping from a little further afar and in other communities, because it did happen in Newtown, but it could have happened anywhere.
Right.
So
but it was close though.
Right.
It was so close.
So close to home. Yeah.
It hits home.
Right.
And so again, that focused you. So what have you in the planning stages of this? What have you learned? What's new?
I mean, you start looking into statistics when you hear this type of stuff. You say, well, how often and how frequent is mental illness found? And the stats out there, like over 1 out of every 4 American adults might have some sort of mental disorder.
Is mental disorder one of those things where it goes unreported because and also
Largely.
like undiagnosed for the most part?
Largely, there's a huge stigma attached to it.
Yes.
That having some sort of mental illness or disorder means that there's something wrong with you, and we're committed to making sure people know that's not the case. But us saying that isn't going to do everything. So having events like this where we're going to raise awareness, and the money's going to all go through the United Way. And they're going to really distribute it to local agencies and organizations in the greater Meriden, Wallingford area who are committed to mental health. So we know that they're going to put it to the right places and make sure that the people that are using it are putting it towards research or further awareness or something like that.
Do you find that advancements are being made in the field in general? I mean, I know you're not a doctor, but can you just see what's going on in general in society?
Yeah, I was actually speaking to someone from the United Way this morning, and he was saying that, sadly, sometimes events like this are more powerful than anything we could do without events like this, and that we hate to ever wait for a terrible event to happen, but when it does happen, it brings you just this really powerful interest in some of our causes that we can't generate on our own. So I think that mental health care is a very hot topic now. Actually, May is Mental Health Awareness Month, and May 5th to 11th, which actually is the week leading up to our event, is Children's Mental Health Awareness Month. So hopefully there's a lot of really good, powerful discussions this coming month.
And that might be something that people don't think about. When they think of mental health, it's an adult, and they may not even think that kids can be affected by it, directly or indirectly.
Yeah, I know that our Chief Behavioral Health Officer, Dr. Tim Kearney, is very committed to children's health in particular. He's been on a bunch of local radio shows recently talking about that. He's really committed to it, which obviously if he's the director, then all the way through we're very committed to it. And catching mental illness or even evaluating the potential for it at a young age is very critical.
Mental illness, too, by the way, is also a very broad umbrella that's used for a lot of different things.
Right.
Maybe in certain cases incorrectly, but it's so broad, and so many things could kind of fall into that category a little bit.
Yeah, and I like to behavioral health is I think the preferred way to use it now. I think that's the preferred terminology. And behavioral health means that it's not even just like that it's an illness, but if you have chronic pain, and like say it's even a shoulder pain, and that's just continuous over time, and you're taking pain meds and it's not helping, there's a lot of interesting studies out there about how much of that pain that you're feeling might be behavioral and how much of it's actually the medical side. So I think that's a big part of it too, is making sure people know that if you're having some sort of chronic pain or some sort of medical condition, that there could be more to it, and that anxiety or stress could be bringing a lot more discomfort and difficult times to your life than you really think.
So the mental could cause the physical, and it's a bad domino effect.
And vice versa.
And vice versa,
yeah.
And then it could be a domino effect. And
right.
So again, that even more so, like such a broad umbrella, not mental health, but what is the proper terminology for it?
I think behavioral health is the preferred term right now. Yeah.
And are there political overtones and kind of politically correct connotations now with this as a disease in general?
I think obviously we want to make sure that everyone knows that mental disorders are serious and that we want to deal with them, but we don't want people to be afraid of them or of people who they suspect might have them. It's just like having a broken leg. I mean, obviously it's a different type of medical condition, but it's something that a lot of people live with. Like I said before, there's approximately 60 million people living in the U.S. with diagnosable mental illnesses. That's a lot of people.
Yeah,
that's a lot of people.
Why is there a stigma around it? I mean, we talked about it, but why is it? Is it just an embarrassment? Is it person's pride?
I think it's a mixture of people themselves not wanting to admit that they might have one, and other people looking from afar and saying, "Oh, if that person has a mental illness," and I think a lot of it
don't want anything to do with them.
Right, and I think a lot of it comes down to people who might not be educated properly enough and not actually know or be able to differentiate between what's a mental illness, or maybe something less.
And that's a good point. You don't try to self-diagnose either. Even if you suspect there might be a problem, should they just immediately, get in touch with a professional and just be diagnosed?
I'd say so, and that's a big part of the efforts that we're making, are to remove that stigma and make sure people know that if there's something that they think might be wrong, then to really see one of our clinicians. And it's all confidential, so we're not going to go and spread the word that you came and visited us. We just want to help you.
Can you see a light at the end of the tunnel for it? I mean, is there progress being made every day?
I think so. I think that there's definitely. I mean, it's slow and steady. Nothing's going to happen overnight, especially in a country as large as ours. It's going to take a while, but I think
advocacy, though, right? Get the word out.
Yeah,
spread
advocacy.
The word.
Yeah, absolutely.
Right. I want to get back to the 5K
Sure.
because it's an event that's coming up. I just want to know what people can do to get involved. They can participate in it, but maybe volunteer in another way if they can't actually do the 5K themselves.
Oh yeah, you want to go to startlineraceservices.com. You go to calendar. There's a little link at the top. You click on calendar. Our event's about 5 or 6 down. It's on May 11th. It starts at 9 a.m. There's a kids fun run at 8:30, and registration actually starts that morning at 7:45.
Was it a run, or can you walk too?
Yeah, it's a run and health walk.
Okay.
So it's a 5K run. I think the health walk, you can walk up to the 5K if you want. You can also walk 2 or 3 miles. There are going to be serious runners there. We're not discouraging that, but we also want people who have kids in strollers or people who want to go for a casual walk to do that as well.
I was going to ask you about the strollers because they want to bring the kids out too.
Oh yeah, and we do have, like I said, there is a kids fun run at 8:30. And there's actually a superhero theme to that. So Spider-Man's going to be on site.
Oh wow,
yeah,
okay.
There'll be face painting afterwards, and we're actually having a best cape design contest. So the kids aren't going to run with the capes. We don't want any accidents there.
Right.
But afterwards, there'll be a full table set up. The Meriden YMCA is helping a lot with that. So we're going to have a full table set up. They can decorate capes, decorate masks. And then after the actual event is over, we're going to have a best cape contest at the same time as the 5K award ceremony is going on.
How about pets? Can Lucky come along?
I think that we're trying to discourage having dogs on the course, just for the simple reason that if there are serious runners, we don't want anyone getting freaked out or any sort of accidents. But I think bringing your dog to the park on the day of, Hubbard Park is a beautiful park. It's daffodil season, and the Daffodil Festival was this past weekend, so It's a beautiful place to go right now, and we're definitely encouraging people to just come out and see what we have on tap.
It's interesting. It's a 5K, and it's for a benefit, and the word is out about it. But there's always going to be those serious runners that no matter what, their goal is to win this race, no matter what.
Yeah, and we have that. The top place finisher for men and women will both get a trophy, and then we're going to have awards for the top 3 finisher in each male and female category.
Do people form teams? Can they form teams or anything like that, or is it just an individual thing?
It's individual in nature, but I mean, obviously, we're not discouraging anyone from having teams. I think that an idea that's already come up for next year. That's a big part of this, is that we want this to become an annual event. Is for there to be a team option.
Rain date, or is it just rain or shine?
No, rain or shine.
They're going out.
Yeah, we're going to have a health fair that day as well. So we're expecting the award ceremony and the 5K, all the actual physical activities, to be complete prior around 10 a.m. But from 10 a.m. to 12 noon, we're going to have a health fair. So we have, I think as of this morning, 17 organizations who are either just committed to wellness or behavioral health or just to general health.
That's
or,
great.
Anything, they're going to be there.
That's great. So it's part of the same event.
Yeah,
so it's like not necessarily an all-day thing, but you probably spend as much or as little time there as you want.
Right. And there's actually a fishing derby going on the same day in Hubbard Park over by the lake. So for us, like I said, the serious runners are welcome to come, and there's going to be stuff for them to do. There's refreshments afterwards. We'll have water. I think Dunkin' Donuts has signed on to help out Subway. So they're all going to be there. But
I was going to ask you how much corporate involvement there was in it too. And
yeah,
you just mentioned
and
that.
I can get into that. We have eight sponsors. Anthem Blue Cross and Blue Shield is a big one. They're helping out a lot, and they're really committed to what we're doing. To not embarrass anyone, I don't want to go through all 8 of them, but we have quite a bunch of local.
They can
health
find out on the
organizations.
website, right?
They can, yeah. If you go to our website, the press release is on there. Again, on Startline Race Services, it has all the information, and you never know. I mean, we have so many organizations involved. Your organization, your healthcare provider might be involved as well, and they'll have more information.
Now, how about a little bit more on the volunteering part for things, or any specialized needs that you still need for people can be involved if they can't do the run or the walk, but they want to be involved somehow?
Oh yeah, there's a volunteer contact on the website. I think Melanie Wild is the person that we're sending it to. Anna Rogers is another name you might see on there. So if you see either of those names, there should be an email next to it. Click on that, send them an email. They can get you the volunteer forms online, and we can get you to help out. Because volunteering is a huge part of an event like this.
Sure.
At this point in time, we have about 110 people registered in advance, which is pretty good for a first-time event. And it's a busy weekend. It's Mother's Day weekend. So we're going to need some volunteer help. They're going to need a water table. You're going to need people to take care of people's really young children when they're actually participating. So there's a lot of places for volunteers to have a really good impact.
And the first one is crucial because it'll determine, because you want to go bigger and better, subsequent years, but you want this one, you want as big a turnout as possible. Rain or shine, come on out and help support the cause.
And that's a theme we've really been hammering home, is that this is going to be an annual event. And maybe some of the sponsors change. CHC is going to be there through and through, and the City of Meriden is going to be there through and through every year. And maybe the the theme of it, if it's behavioral health every year, if there's another health-related cause that we think is more important next year, then we'll do that. But we're committed to having this event, making it a community event, and getting as many people there as possible.
One more time on the website so people can sign up or learn more or whatever they want to do.
Yeah, startlineraceservices.com.
All right.
If you go to chc1.com, that's our actual organization website. There's more information on there as well.
And you're plugged into social media, so I'm sure there'll be
Facebook,
posts
Twitter,
all over
everything.
that too.
Yeah.
If you go on the website, I'm sure you'll be able to find the links for all the social media sites.
Absolutely.
So go check it out. Great cause. Pat Wilds, he's an AmeriCorps member, and we very much appreciate you being on the show
Thanks
today.
for having me, Sean. Appreciate it.
And thank you for joining us for another edition of For the Record. You can see this show and many others on our YouTube site. In the meantime, that is our show for today. Take care. We will see you next time.